Oh, hello! So, I wanted to talk about rhinoplasty and its individual components today. There's a lot of confusion about what is rhinoplasty and what is tipplasti, what is alarplasty, what are osteotomies, what is hump removal, what is closed, what is open. Let's start with the simple basics. You can see the picture of the nose, and in that picture we'll start from the top and work our way down. If you look at the top portion, just like you can see here on my nose, the upper half right here, those are the nasal bones. If you squeeze, you can see where they end, the soft part. As you go up, they're right there. They're like a pyramid, like this. Those are the nasal bones. Breaking the nasal bones is called osteotomies, and they can be done in the center, they can be done halfway or all the way down. This would be what they call, or what we all call, medial osteotomy. In halfway, intermediate osteotomy. All the way down, lateral osteotomy. Osteotomies are used to bring the hump down and also narrow the nasal bones. Osteotomies are a part of rhinoplasty. Any individual procedure is part of a rhinoplasty. So that's the first one. Then let's come down. As we come down, we see the tip. You can see it marked up there as well. And this is the tip area right here, right there. It doesn't go above this portion, just right here. So with the tip, it can be made narrow, it can be brought down, or it can be brought up. Any of these changes will be called tipplasti. And there are two approaches to it. One is closed, where anything you remove will be done from inside the nostril. So there's no cut on the outside. In the open approach, there's a cut underneath here that allows us to lift the skin and directly visualize the cartilages and soft tissue. So now you know the tipplasti. Again, tipplasti is a component of rhinoplasty. Now we move down to the nostrils, right here. So the nostrils are separate from the tip, right here. Nostrils are called ala. That's the Latin word for a wing. Now with alarplasty, we narrow the wide nostrils and we bring them in. That can be done sometimes by stitches without any cuts, although not effective, or it can be done with incisions, which vary in different categories. So that would be alarplasty, which is again a component of rhinoplasty. Now, all of these things, even an individual component, can be referred to as rhinoplasty. If somebody says, oh, I'm getting a rhinoplasty, and they might only be getting an alarplasty, which is fine. Or they might say, oh, I'm getting a rhinoplasty, but they're only getting tipplasti. That's okay as well. If you want to address just the individual component, you can use those terminologies like tipplasti, alarplasty, osteotomies, or hump removal. So any of the terminology you use is within the rhinoplasty word. And I hope that clarifies some of the confusion. And you can use a combination of all different individual procedures and have a full rhinoplasty. There we go. And if you have more questions, reach out and I'll try to explain again. Enjoy the rhinoplasty.